got mine. Hopefully you've got yours. And I guess we're more than halfway through another week. Actually, you folks are closer to the end of the week. Still Wednesday here. And also in this country, Canada Takeout Day. That's something the restaurants here have put together, and I'll tell you more about that later in the program. But first of all, let's gather around, get that second cup of coffee, and find out what's happening in Canada today. First, a look at the weather. The sunshine is gone, and there's light snow falling in our area right now. We had a bit of rain overnight in Edmonton, but that's now changed to snow. Here in Edmonton, this is what it looks like in my city. I love the sunshine, but it's still chilly, only 2 degrees. Across the country, mostly sunny. The West Coast had high temperatures of about 15 degrees. On the prairies where I live, we're still pretty chilly. Temperatures in the -1 to +3 degree range. Cooled down substantially in Ontario and central Canada. Toronto is reporting only 4 degrees. Up in the nation's capital, of Ottawa, 1 degree with rain. 9 degrees and clouds in Montreal. Cloudy and rainy with an average temperature of +5 degrees across the 4 Atlantic provinces. In the news today, first a look at the numbers. Canada has more than 28,000 coronavirus cases, resulting in just over 1,000 deaths. Of the reported cases, more than 8,600 people have recovered. Now, here's how things look across the country. We'll start in central Canada, Ontario and Quebec. That's kind of the epicenter here. Those 2 provinces report more than 80% of the cases in this country. Toronto reported 500 new cases today, bringing the total to about 8,500. There are 52 more deaths, bringing the death toll to 433. Quebec has an additional 612 cases for a total of 14,800 confirmed. 52 new deaths have been reported in the last 24 hours for a total of 487. The 4 Atlantic provinces are reporting 37 new cases. And as we move to the West Coast, British Columbia, things appear to be leveling off there. They reported another 5 deaths, but the province has extended its state of emergency for at least another 2 weeks. So that lockdown is going to continue. In Alberta, we reported 2 more deaths yesterday, both of those in seniors facilities. And we'll be talking more about seniors facilities a bit later on in the program. Saskatchewan reports 3 new cases, Manitoba, none. Now, a common theme I've heard from both politicians and public health officials is the need for more testing. But, if testing is increased, we're going to see an increase in the number of cases. Public health officials say that's a good thing. Why? Because now they know where the disease is. They can have a better idea of where these reservoirs of infection are. And as a result, they can devise better strategies on how to control it. And control is the key issue here because that's all we've got. That's all we can do. There is no cure. There's no vaccine yet. So the only way we can handle this is control it. Controls are the only way we can keep this virus in check. In Canada, how close are we to winning the war? Don't know. It's going to be a while yet, but we did have a note of optimism from our Chief Public Health Officer, Dr. Theresa Tam. Dr. Tam thinks the rate of growth is slowing. Now, look at these figures she gives us. She said last month, in March, the number of cases in Canada doubled every 3 days. Now, here we are in April, they're doubling every 10 days. Bit of good news there. I'll take that. But sadly, Tam says over half the deaths that are recorded are linked to seniors' homes. There's been numerous reports of horrendous conditions in some of these homes, particularly that one in the Montreal area. But even in the well-run facilities, even there, a nursing home provides a haven for pathogens such as the coronavirus. You might have a large number of, you see, the reason why is you have such a large number of people in a confined environment. Many of them have other medical conditions and this compromises their immune systems. It's just, quite frankly, an outbreak waiting to happen. Our Prime Minister, Justin Trudeau, says the issue of COVID-19 and its devastating effect on seniors has to be addressed.
I can't imagine what so many Canadians are going through right now. With loved ones who are suffering, people they can't even visit right now, seniors worried about falling ill and not being able to see their kids and grandkids again. These are the things that we need to focus on as a country. That is what I will be speaking with premiers about tomorrow night, how the federal government can support the premiers in their responsibility in their jurisdiction over long-term care facilities and senior care, to make sure that we are supporting the heroes who are working in extraordinarily difficult situations for very low pay, to continue that work safely and mostly to keep our elders safe. This is a situation where, as a society, as a country, we need to pull together to be there for our elders who built this country. That's what we're going to focus on in the coming days.
Now, Trudeau also announced he'll work with the provinces to boost the wages of essential workers, some of whom are making less than $2,500 a month. Several of these workers are employed in long-term care facilities and nursing homes. And many of the caregivers Trudeau refers to were trained in the Philippines. And here, they're valued as invaluable in our healthcare institutions. We salute them as heroes in the war against this pandemic. One of the biggest challenges Canadians face during the pandemic is preserving their mental health and wellness. The isolation is brought about by the lockdown has taken a toll on many people. They're alone. They don't know how to cope. Social connections are gone, at least for the time being. Life is different. Life is uncertain, and uncertainty is very, very difficult for many people to handle. In an effort to help, Prime Minister Trudeau says the Canadian government has set up a new resource dedicated to mental wellness.
If you're feeling overwhelmed, know that you aren't alone, and there are people who can help. We have launched a mental health portal at canada.ca and through the Canada COVID-19 app, where you can go to find support. So if you need to, please reach out. We'll be there for each other.
And that's the key. Reach out. Don't keep it in. Now, this website will connect Canadians to peer support workers, social workers, psychologists, and other professionals, confidential chat sessions or phone calls. It'll make it easier to find credible information and also help address mental health and substance use issues. A special resource has been set up for children. It's called the Kids Help Phone. Provides young people with the mental health support they need during this difficult time because, schools have been closed. They have reduced access to community resources, whether it be recreational programs, minor sports, completely shut down. And for many kids, that was a large part of their social support network. Well, here's something interesting. Bet you didn't know. Money isn't all that dirty. Canada's central bank is encouraging businesses still operating to continue to accept cash. That's right, paper money. The Bank of Canada says customers and businesses should use whatever form of payment they're most comfortable with. It says not all people have debit cards, not all of them have credit cards, and refusing cash places an undue hardship on some people. A lot of retailers have signs up asking people to pay, when possible, electronically with their credit or debit cards. But interestingly, this Bank for International Settlements is based in Switzerland. It advises central banks around the world on a number of issues. It put out a research paper earlier this month on the risks of banknotes transmitting COVID-19. It says scientific evidence suggests the probability of transmission via banknotes is low, especially when compared with frequently touched objects such as credit card terminals or PIN pads. Something I didn't know there. Well, here's one place I won't be going soon. This This is Lake Louise in Banff National Park. It, along with other national parks, is closed to visitors right now. Parks Canada says there'll be no camping or group activities at all national parks across the country until at least June. As part of the ongoing push to keep people at home, to limit the spread of COVID-19, all events at national parks, national historic sites, heritage canals, and national marine conservation areas are suspended until the end of May, at least. Parks Canada not taking any new reservations until June 1st, and all existing reservations up until then have been canceled, and the money is being refunded in full. I just love the view of that park there. Oh, got to tell you this. It's Takeout Wednesday. The Canadian restaurant industry has been decimated by the COVID-19 pandemic. Not only have thousands of workers lost their jobs, but many eateries have gone broke. They won't be reopening their doors. That means those workers have no job to go back to. Now, many restaurant workers and owners are part of Canada's Philippine community. Some here are on temporary visas, but thousands are now permanent residents of Canada and an integral part of the business community. Restaurants Canada is an industry group and figures 18% of eating establishments will permanently close if things don't improve in the next month. So to help keep the food service going, every Wednesday now, beginning today, and it is Wednesday in Canada, every Wednesday is Takeout Day. In about an hour, the group is going to be hosting Canada's Great Kitchen Party, Home Edition. That's going to be up on social media. It's a virtual concert featuring Canada's top talent, some celebrated athletes. People are encouraged to take this event in, just sit down and watch it while enjoying a takeout meal. What's your favorite? Maybe, well, I'm not supposed to mention brand name here, but maybe some pizza or chicken or something. You know, and when the pandemic ends, hopefully there'll be jobs for people in the food service industry to go back to. Just a couple of quick notes. I was listening to a police officer this morning on one of our local radio stations talking about how COVID-19 has changed policing. He said, yeah, we try to stay safe. We try to keep our distance, but sometimes you got to arrest a bad guy. And they like to cough on them, just create all kinds of grief for police officers. And then they tell them they got COVID-19. You know, it's just terrible what some people do to those that are serving us. Police do say, though, there's been a drop in violent crime. There's been a drop in robberies, that sort of thing. We've had no looting in our area. All in all, Canadians are fairly well behaved. Meantime, I wish you all good health. Take care of others. Take care of yourselves. Stay home and stay safe. And stay tuned to Eagle News for the best, accurate, and balanced coverage of the COVID-19 pandemic. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times.